Today we have Dr. Andrew Wengert of Veracity Soft Tissue and Spine. Welcome, Dr. Andrew.
It's good to be here. Thanks for having me.
I'm glad to have you. So what is your background in holistic medicine and what's led you to do what you're doing today?
So I went to chiropractic school, so that has its own holistic approach to it, trying to figure out root causes and not just treating symptoms. And so I finished chiropractic school. We learned about adjusting the spine and the importance of that. But as I got further into practice, in talking with colleagues, I discovered the importance of addressing the soft tissue as well. And that really kind of led me down the trail of really focusing on adhesion and fixing ranges of motion for patients who have chronic pain conditions. And that's been my focus for about the past 10 years.
So linked with adhesions and such like that, is inflammation something that you've seen on a regular basis?
Absolutely. I mean, inflammation is the root cause of any problem that a patient has, specifically a pain problem, which is what most likely will bring someone into my office. And one thing that I try to harp on is inflammation by itself is not necessarily a bad thing. You need inflammation, right? But figuring out why that inflammation is there becomes more my job. So during my exam, I'm trying to figure out, could this be a dietary thing? With what I specialize in, is it a movement thing? Does the person not move well? Are they doing too much of a certain movement or a certain posture that's leading to the inflammation that they're dealing with? But so figuring out that root cause becomes very important for trying to get our patients better. Patients will frequently come in asking about certain medications. Should I be taking an anti-inflammatory? And they certainly have their place. Like if it's stopping you from being able to do your job or get sleep, there's a place for that.
Right.
But I'm always pushing, trying to figure out what's causing that inflammation. Because without inflammation, you can't have healing of those tissues. So that becomes a big issue and a big communication point with patients.
So I'm just curious, what is your patient base like? Who are you seeing? Do you have a typical patient that comes in?
Yep, no, absolutely. Most of our patients are exercise people, or they do some sort of bodybuilding, CrossFit, and then we have our recreational athletes as well. And from that patient base, it's grown to, we see some pediatrics, we see some geriatric patients, just they get referred in from that kind of athletic base.
Right.
Yeah, and the concepts still apply. It's still figuring out the exact tissue that is causing the symptom that they're having and looking at their movement or postures, things that could be overloading and causing the symptoms that they're feeling. So the rules stay the same, the concepts stay the same. It's just a matter of applying it to, is this a 14-year-old? Should a 14-year-old be having back pain every day? Like, usually with younger patients, it tends to be more kind of serious things if they're having pain. You look at like stress fractures or, some type of an actual injury, because a 14-year-old really shouldn't have that much degeneration going on that they're having pain every day. Right. Where with someone on the opposite end of the spectrum, let's say someone who's 70 years old, you would expect like degeneration would be a very likely cause for the symptoms that they're feeling. So that kind of leads us in our exam figuring, okay, this person probably has degeneration that would be responsible for the symptoms that they're feeling.
And I would think, I've just been watching, because obviously we're here together in the same building.
Yeah.
I'm assuming there's a number of patients that you're not the first person they've come to.
Absolutely. We even market ourselves, like if you've been to 3 to 5 other providers, right. That is our ideal patient. Yeah, like, because we just look at things a little bit different, I think.
Right.
I think a lot of providers out there don't look at soft tissue as a primary cause of problems. So, if you had a problem that your average physical therapy treatment is going to fix, you would have probably gotten it fixed by now. Or something that an adjustment would have fixed, you've probably had it fixed by now. But if it's something else soft tissue, because it's so frequently overlooked, and they're really common. Soft tissue problems are extremely common. I feel our type of clinic is a good resource for people with that type of problem.
Right, and I was going to say, me as a chiropractor too, it's, early on in practice you're learning chiropractic, but there's a time and need and a place for everything, all of our disciplines.
Yep.
But I think for me, a lot of times, like, we take it from a different aspect. I mean, although I do some soft tissue work, like my focus has been more nutrition.
Yep.
It's fascinating.
And to piggyback on that, that's one of the questions we ask in all of our initial exams are there any foods, environments, medications that make your problem worse?
Right.
Because that's really, really common. Like I had a guy, and I was treating him for probably 4 weeks, and he would get better, but then it would flare up, and then it just kind of that cycle of he was getting a little bit better, but not where we wanted. And then he came in one day and he goes, what really seems to make, he had a knee problem. He goes, what really seems to make this worse is every time I have a dark beer, my knee pain like goes through the roof. And it's like, it totally makes sense. And then he's like, and we kind of followed like, all right, don't do that for the next 3 weeks. Pain levels were way down. He had, we got an MRI and there was degeneration in that knee, but just to kind of go back to inflammation, the inflammation that he was adding in through that type of alcohol that he was drinking was enough to really spike his, go way above his pain threshold and give him a symptom every time.
Right.
So I could do all the soft tissue work in the world, and it's not gonna get, again, root cause. It's not getting to that root cause for him.
Right.
So it really, for that patient, that was the thing. And like, what did the soft tissue work help that? No, but because of the system we use in figuring out, what type of thing, what's the root cause of what your problem is.
Right.
He answered it himself after some time, unfortunately, but we were able to figure that out for him, and that got him relief. He now has control over his problem.
Right.
If he wants to have a drink, he knows he's going to possibly pay the price for having that. So.
Right. It's interesting. All the people I've interviewed thus far have all been holistic practitioners, and what just makes me really happy is all of us are getting it.
Yeah.
Like, we're looking at many different things, many contributing factors.
Absolutely.
But that was my story, actually, which, there's many things that led me to do even nutrition in my practice, but mine was I had herniated discs. They've been healed now with stem cell therapy for real.
Yeah.
But for years I was having issues intermittently, and I know some things to do and some lifestyle things to do, but I was missing it with gluten. And I always tell people that's not everybody's problem.
Yeah.
But for me, if I would have, and it didn't have to be a big piece of anything, but half a bagel here and the next day a couple crackers and this and that, I would feel like somebody kicked me in my lower back.
Yep.
Once I got off of that, although I did have degeneration, I still had some herniations going on.
Yep.
I wasn't really as acute.
Yep. No,
So.
Absolutely. And I think it's, the knock on almost all conservative care is the practitioner, like the doctor only does what they do. Like the chiropractor only does adjustments. The physical therapist only does stretching and strengthening. The person who focuses on nutrition just gives supplements and nutrition advice. But if you can just take a step back, and it's not that you have to do each of those things,
Correct.
but you have to be able to figure out, is this person walking into my office in my lane, or is this someone who needs someone else? Like, if someone comes in with a nutrition thing, I would send them to someone like you. Like, this is a nutritional problem. This isn't a soft tissue problem. I'm not going to fix this with an adjustment. I'm not going to give them an exercise that's going to fix this. It's the ability to be able to figure out what lane this person needs to be in, and then getting them there. And that's been, as I've been in practice practicing the soft tissue stuff for 10 years, practice for 14 years, it's almost like as I get better, I'm referring more cases out than I'm keeping in my office, which sounds strange, but it's like me realizing this person isn't ideal for me. They should be somewhere else.
But that's also an excellent practitioner. We're supposed to be helping the people we can help.
Yep.
We're not supposed to be milking it along the way.
Exactly.
Right. So I guess a good segue to that would be just even stem cell therapy. Where do you feel that application or that treatment would be advantageous?
Well, I think it's huge in that, like, if you're looking at, so let's say the majority of people who come into my office have degeneration, right? So they have a breakdown of cartilage, of disc, of ligament, whatever it may be. They are going to have inflammation because of that degenerated cartilage. If that can be regrown, I mean, if you're looking at it from a root cause aspect,
Right.
the cause for that symptom is the damaged cartilage. If you can regrow that cartilage, and at the same time, if we're taking a step further, having good function, having enough range of motion to load your knee properly, having enough strength to support your knee as you're moving. I mean, that's because look, the biggest limitation for me as a practitioner, I can improve your range of motion. I can strengthen the muscles around it. What I can't do is regrow the damaged cartilage in your knee or regrow, the disc degeneration in your
Correct.
spine. If stem cells can get that sweet spot and you can, I mean, that's anti-aging right there. If you're having good function and regrowing damaged tissue, I mean, that makes you younger. That's what everyone wants.
Right.
That's it.
I mean, I know with me, I was taken back, and I said, I was looking at this initially for my brother with a traumatic brain injury,
Mm-hmm.
and I did say, like, if this improves David and our family, like, I'm on board.
Absolutely.
But for me, what blew me away, and I did not expect this with me, I've been a chiropractor 26 years probably, maybe even more at this point if I added it up,
Yeah.
I guess. But I didn't expect the healing I had, and I love the way that I had it applied. Mine wasn't in a specific joint or in a specific muscle.
Mm-hmm.
Mine was systemic in my bloodstream.
Yeah.
But it repaired my 3 rotator cuff tears in my right shoulder and the labrum, my supraspinatus tear here, and 2 herniated discs. So
Yeah.
it was brilliant.
That's awesome.
Back to you though, I guess I'm curious, like if somebody was going to call you to come in, what is the process? What happens? Because there are so many people that really, the end game is something that you can help
Yeah.
them with.
I mean, to me, the most important thing is the exam. So a lot of patients will call and they're trying to get answers because they've been burned by the system before.
Right.
They're like, well, what do you do that's different? And it's hard to, the challenge I have is, well, what we do is different, and that people will ask how. And it's like, well, we put you through a detailed exam to figure out exactly what's wrong with you. And everyone's thought is, well, doesn't every doctor do that? Like, what's different about that? But the reality is, no, a lot of them don't. A lot of doctors are overbooked. I mean, we'll hear all the time, and I'm not knocking orthopedic surgeons or
Right.
knocking people that take insurance, but if you work in that world, you are forced to do volume. Like, you have to see a lot of people to make money. And we'll get patients coming all the time like, this guy didn't even touch me. He talked to me for 5
Right.
minutes and sent me to PT, and it's, that was the end of it. And they did 6 PT visits, it wasn't getting better, and they quit. Like, so it's just, so back to your original question, it really is the job of the initial exam is, should you even be in my office?
Correct.
Like, is this even appropriate for
Right.
you? And then if it is, we have to figure out exactly what's going on. We always say a tissue-specific diagnosis. We need to know exactly what is causing your symptom, and then what factors play into it. Are you under high stress? Do you get sleep? Are you dehydrated? What's your nutrition like? And then my bread and butter is the musculoskeletal, like the functional stuff. Are you strong? Do you have good range of motion? So it really is detailed, and I think a lot of people don't. They think everybody does that, and in my experience, they really don't. Because again, you have shortcomings just with, you're up against time constraints. If you're taking insurance, you have to do volume. Our clinic doesn't.
Right.
That tends to be another thing that it's hard for people to get past, because I understand you worked hard, you pay into your premium every month. You think you should be taken care of, but just with the way the system is set up these days, insurance doesn't reward providers that do good work. It rewards providers that do a lot of services.
I would say amen to that. It's really sad that it truly is a numbers game. I get really frustrated. Obviously we're doing it different here.
Yeah.
I spend time with my patients too. But like we're talking regular medical, a lot of it is, and I've gone to appointments with my brother and my mother, and it's hard for me to keep my mouth
Yep.
shut, and I
Yep.
wait till I get in the car.
Yeah.
But just what's your chief complaint? First of all, if you're talking about specific different things too, like maybe in our offices, aren't my shoulder, I can't do, but still there can be other underlying things like you and I are both saying.
Yep.
but somebody that has, say, generalized fatigue,
Yeah.
and they're not telling you about the headaches they're getting, or that they were bit by a spider, or I have no idea. Like,
Yep.
you need to take a thorough history. So a
Yep.
lot of times I really feel like people are really missing the boat, and it's
Absolutely.
a complete detriment.
One of the biggest compliments we get, and patients don't even realize they're giving us a compliment with it. And it's almost sad when you have somebody who's been dealing with chronic pain, is they'll be like, "Thank you for listening to me and
does it
taking the
break your
time."
heart?
It's like, you've been to 5 other providers, and this is the compliment you give me, is that I listened to you. Like, that's just. I mean, our initial exam is 60 minutes. Like, an hour is, we can find out a lot of stuff in an hour. Where you talk to other people, if you're going to an ortho consult, 5-10 minutes with these guys.
And,
it's
and I think the thing is too, it's like, you're a hands-on person, I'm a hands-on person, that's how we were trained. You're having this issue, and all you're doing is looking at a sheet of paper and like, it's this, and this.
Yeah.
All right, yes, they might have a herniated disc, yeah, they may have this and that, but really,
You gotta
the
dive
cause
deeper
may
than that.
not even be that. But
Absolutely.
please put your hands on these people.
Yep, absolutely. Yeah, it's just, I mean, it's sad that that's the way the system is, and I don't fault patients for not knowing that.
Right.
It is not on them, and I don't even fault the providers. You get put into a certain, you've got to pay bills, you've got to keep your lights on, you got to pay your staff, you got to pay your, the billing and everything else that goes with it.
Right.
It's just, I don't fault them, but it's the reality of what the system is at this point.
Right. So I have a question. What emergent trends or things are you seeing that are kind of like hip or big right now that would impact your practice for the good or the bad? Or what are patients telling you? Where have they been before?
I would say emerging, I mean, just with the emergence of social media, you can get, I'll put it this way, there's a lot of information out there, right?
Right.
Some of it is really good,
Right.
and some people can give excellent advice, and some people can give, I wouldn't say awful advice, but advice that doesn't apply to that person. And it's like we were just talking about, like, you have to have the specifics of that person's case figured out, and the 90% of patients aren't able to do that for themselves.
Right.
Like, they don't know. They'll watch some guy on YouTube that says, okay, try these stretches for your shoulder pain. And, for some people that may actually work. For other people, it may make it a lot worse. Like, it's just the kind of sifting through the information and figuring out what's appropriate. So as far as like emerging trends, I'd say almost all of our patients try to fix themselves first, which I can appreciate. You don't want to part with your time and money to go see a provider that likely won't figure your problem out
Right.
anyways, or won't get you the exact answer you're looking for, the result you're looking for. So I can absolutely respect that. I mean, regenerative medicine is a huge topic right now. Everybody's wants to know about PRP, stem cells, and that absolutely has a place. And again, that falls in with figuring out, is that appropriate for the patient
Exactly.
that's coming into my office? Does everyone need that? Absolutely not. But if someone has their good range of motion and they have good strength and there's no other, metabolic things going on, and that can be the sweet spot treatment for them, absolutely. That can, in reality, if it regenerates cartilage, I think it can help everyone that has any degeneration anywhere. And that's strictly looking at it from a musculoskeletal standpoint.
Correct.
You know more about the other stuff.
Right.
I'm just looking at it from in that lens.
Yeah,
there are numerous other things that I'm not educated on, but
Right.
it certainly has. And I think they're just starting to figure out how to do it and the benefits of it. And I think they're going to find more and more things as time goes on.
I feel like it's just starting for sure. It hasn't exploded yet.
Yep.
And I'm really excited with my patients just to watch. Like, I'm doing follow-ups with them a couple days out, 6 weeks out. 6 weeks, 45 days out, 90 in 6 months. And I get so excited, like a kid at Christmas, when I'm talking to these patients, just
awesome.
About the improvements that people are having.
That's fantastic.
For sure. So how do you approach dietary changes for your clients or potential patients?
Well, I'm going to be completely honest. It is not my area of expertise.
Okay.
So I can give basics like, look, try to decrease sugars, things that are going to cause inflammation to be problematic for people.
Right.
So decreasing sugars. I'm a big especially with more like the weight loss or people who have a weight issue, like macros become very important to patients. Like you have to, people say you don't need to track, you have to measure what you're eating. You don't necessarily have to put a scale out in front of everything, but you got to have an idea of, you know, calories and how much is in there. Because if you're eating too much, you're going to be inflamed, even if you're eating all good stuff. But it's, from the dietary standpoint, try to make sure they're getting enough water. It's amazing, especially living in Florida, it's so hot here, how many people are just not drinking enough water.
Right.
Or they drink something else that is actually dehydrate. You know, they have coffees and energy drinks and alcohol, all these things that dehydrate them. And just for I don't think there's a process in the body that doesn't require adequate hydration.
You're correct about that.
But other than that, it's kind of a topic I would send out.
Right.
If that was a primary for them.
Right.
I would send that out just because it's not my area of expertise.
That's true. But how about lifestyle? What things? Because I know you get a lot of people that are big CrossFit people.
Yes.
And really pushing it.
100%. So when I first started out, the majority of my population base was, all right, I need you to do something. I need you to go for a walk. And now it's like the same thing. I'm trying to tell people, can you just go for a walk? Like, you know, these people are working out 2-3 times a day, 6-7 days a week, and they're wondering why, you know, things are hurting. And it's like, you're not meant to do this. Like, it's too much. And clearly it's too much if you have an injury, like your body's screaming, your shoulder's screaming at you to stop and take a day off, and you're overdoing it. So, and I mean, we can break it down even more. Like, and I don't think you will find a bigger proponent of exercise. Like, I'm a gym rat myself. I want my patients working out and doing the things that they love more than anyone, but it's gotta be in a way that's gonna create a healthy environment for whatever you're dealing with. So with that, we can make lots of modifications to the exercises or activities that you're doing. And then a lot of it we call that load management. You're just managing the load on your injured body part. And it becomes more of also realizing, like, look, the things you do outside of the gym or the tennis court or the pickleball court now, that's the big one, matters as well. Like if you have an hour-long commute both ways and you have a desk job, that's 8 to 10 hours of sitting you're already putting on your spine and your neck before you even do your physical activity. Right. You need to realize those things outside of the gym matter just as much, if not more, as what you're doing with your exercise or workout or whatever activity it is that you do. So that becomes a really load. If I could pick between soft tissue work, strengthening exercise, and load management, I could get the most people better just by dealing with load management. That's just, if you can nail that, you can do really, really well.
That's fascinating. Yeah. So what ways have you found to kickstart regeneration in a person's body?
So 2 years ago, with the training that I go through, the system, we started using a treatment called radial shockwave. Okay. So with that, what it does, it's a machine that uses sound energy to break down adhesion in muscles. But the other thing that they found with it is it wipes out what are called senescent cells. So within cartilage, within muscle, you have these zombie cells, these aging, dying cells that haven't died yet. So like with fasting, people will talk about like apoptosis. Like you're trying to kill these senescent cells. The shockwave has been shown to actually do that. So I look at the shockwave treatments, wiping those out, and then if you were to then mix in a stem cell with that, it's basically, you know, let's say you've got 20 cells, just to give an example, you got 20 cells in a certain area. If you can wipe out the 17 senescent ones and then get stem cells into that area, I think that creates the ultimate healing environment because you're getting rid of the junk cells and throwing in the brand new healthy ones.
So are you saying a senescent cell, is that what you would call an adhesion, or how?
No, these are two separate things.
I don't know about this.
Yeah.
Okay.
So the adhesion is within the muscle, within the ligament, within the soft tissue.
Right. Okay.
We break that down with the shockwave, but what they've also found is that you can wipe out these senescent cells with the Shockwave technology.
So these senescent cells, are they like integrated within the scar tissue, or are they just like hanging out in this area?
This is going to be in the joint, like in the cartilage.
Joint.
Yes, in the disc, in cartilage, and by clearing those out, you create this perfect situation for stem cells to, in my opinion, go to that area and do their work. Because the way it was presented to me, and again, I'm not an expert on stem cells, but if you have these senescent cells in the area, it's hard to get the stem cells to actually take to that area. It's going to go somewhere else. Like, it'll go and do something positive in the body, but if you can wipe out the senescence in that tissue or in that cartilage, in that joint,
right,
the chances of that stem cell going to that cartilage, taking and regrowing, exponentially goes up.
This is something I'm excited about because I didn't know about this at all, so I'm going to do more research. But this is something potentially
yes, exactly,
we could work together with.
100%.
Because if you know somebody's literally bone on their knee, but they have these senescent cells going on.
Yep, and that's we're looking to figure out a way. I mean, can you measure the senescence without cutting someone up and looking under a microscope? I don't see how that would be possible. But at the same time, it has been shown to wipe out senescent cells.
So should you just pretty much assume that all of us have these senescent cells? And
it's aging. I mean, that's what people talk about apoptosis with fasting.
Right.
That is what you're trying to do. You're trying to kill those dying cells and
question,
get them out.
Because I know you work with a lot of different patients. If you have somebody that's coming in with chronic knee pain or chronic shoulder pain or a chronic disc issue, how deep does this Shockwave therapy go in?
It's a good question. I believe we can go 2 to 3 inches, depending. We have different settings and different heads.
Okay.
So the denseness of the tissue you're trying to get through matters. Look, if we get a lot of very muscular people, it's harder to get to a hip joint capsule on someone like that, right? And then you get someone who's really lean, doesn't have a lot of muscle mass. Like, you don't need as much with that, but. I mean, the telltale sign that you're hitting what you're supposed to. We will treat people with disc injuries in their low back. We will hit that disc, like we will do the treatment on the disc, and it's. I mean, you felt it before. It's almost like a Theragun on steroids. It feels like a. And you will reproduce their symptom, their referral symptom. So you're getting treatment to that disc if you can reproduce their symptom going down. Like, you're hitting it. It's getting to it. I mean, that's kind of your telltale sign. That's what we actually look for, because we want to be getting to those senescent cells in the disc to wipe them out so that, the stem cells can take place.
No, I know you can measure, obviously somebody has adhesive capsulitis or frozen shoulder. Obviously, you're doing ranges of motion and different
testing.
things.
Yep.
But does that go along with, as that's improving, like, the senescent cells are gone? Like, or is there an idea of how many times you have to do it for, like, senescent cells in the knee? Is it still based upon how many treatments you'd need, including the range of motion, all of that, or is it a very different measurement?
It's a different measurement. Right. I haven't figured out a way to quantify breaking down the senescent cells. Right. We can, with adhesion, we can break it down by looking at the range of motion. Like, if we measure your range of motion before, do our treatment, get an improvement, and then you come back in a week and that improvement is still there, we've broken that adhesion down, we've improved that range of motion. As far as with the senescent cells, like I said, it's difficult, other than going by symptoms, for me to quantify what's going on with that.
Right.
And that's kind of a newer age thing. So, I mean, there aren't any protocols with that developed yet. That's the key word. Yep.
Okay. So if people are interested, I know you're right here in Bradenton, Florida, and you're a professional. I should say what you're doing. People really need to be here.
Yeah.
If people are interested but are living in Buffalo, New York, what would they do? How would they?
Well, surprisingly enough, Buffalo is actually a hotbed. I've got a lot of referrals
and I'm from
there.
Buffalo, so that's why I use that word.
There's like 3 providers there, but
okay.
I guess the best way would be to reach out to me.
Okay.
We have a list of providers in different areas where they're all over the country. Hopefully there would be someone near that patient that can help them. But at the same time, we have a lot of patients travel to see providers like myself and other providers, to the point where they'll be willing to, like, take a flight down. I'm like, no, there's someone in Chicago. Like, you can go there. But if they can just, contact me via email or through my website, I can find them the closest person to them. So address is Veracity, VERACITY, STS@gmail.com.
All right, wonderful. And I have one more question. How
Yeah,
did
yeah.
you come up with veracity? I never asked you the
No,
significance of
it's
that.
so veracity means conformity to facts and accuracy, and that was big on, like I said, the importance of the diagnosis. It's actually my sister-in-law created my brand and my website. She's a graphic designer and really big into the branding side of it. And she gave me this homework assignment that took 2 weeks to do, and this was the final word that we broke it down to.
I love it. So I have a question. If people are interested in learning more about you or your practice, because I know you do a lot of education, how can they find you?
I mean, they can. We do, like you said, we do a lot on social media. So Facebook and Instagram, it's just Veracity Soft Tissue and Spine is our Facebook page and our Instagram, I guess, name. We have a website. It's veracitysts.com. I mean, those would be the best ways to find out about what we do.
Okay. Thank you.
Yeah, you got it.
I really appreciate you coming out
Absolutely.
here today, Dr. Andrew.
Thank you so much. Thanks
You're
for having me.
welcome.